Now we're going to move on to understanding treatments of the rotator cuff. So we've already talked about the basic anatomy, we've already talked about the basic injury patterns, and the basic treatments that can be done to prevent the need for surgery. But in many patients, if they have a tendon tear, surgery will become the treatment that is necessary to relieve the symptoms and restore function. So when we look at surgery, we need to look at the areas that are going to be treated at surgery. You'll need to understand what you need to do to prepare for surgery, and more importantly, because most people focus on the surgery itself and not what to do afterwards, more importantly, you're going to have to focus on what the course is going to be like after surgery. And in my opinion, this is where most of your energy should be spent. Most people have anxiety about surgery. This is normal. Although it's my everyday part of my work and I understand the mechanics of surgery, I've also had surgery, so I understand some of the anxiety of what can go into walking into an operating room, knowing that you're about to go to sleep and that you need to have something fixed. The first thing to understand about surgery starts with understanding the diagnosis. So if we've given you the diagnosis of a rotator cuff tear, you now know that this means that the tendon is torn and injured. You also know that this probably is related to an abnormal contact that we call impingement. Those two areas must be corrected at time of surgery. The other thing you should understand is that modern surgery is now very safe and very effective, and almost all of this surgery is done through a tool that we call the arthroscope. The arthroscope is like a TV camera, only this TV camera goes through a light tube and lets us make 3 or 4 millimeter incisions and look at the shoulder without the need for a large incision. The biggest benefit for me using the arthroscope is that I can see the anatomy in a way I could not see before the arthroscope existed. And because of that, I understand the injury pattern in a way that I did not understand before the arthroscope. The benefit for the patient is that because the arthroscope is minimally invasive, this surgery can be done as an outpatient. And outpatient surgery is in general safer for patients, has less discomfort, and for most patients has less fear because they don't have to stay overnight in the hospital. So understanding at this point why the surgery has become necessary, I think, is essential. And one of the things you need to understand is a rotator cuff tendon can be torn and not need surgery. Clearly, we can treat patients with injections and other anti-inflammatory treatments successfully